To health matters now, officials in Adamawa State are conducting a house-to-house awareness campaign to contain the spread of cholera in 2 local government areas. This follows recent reports of rising cases of cholera in Mubi North and South, where about 1,000 people are said to have been infected. Officials of the World Health Organization and the Adamawa State government say the exercise is yielding results.
The recent outbreak of cholera in some northern states in Nigeria is now a source of worry to key players in the country's health sector after curtailing Lassa fever. Even the United Nations health body, the World Health Organization, is also concerned. According to the Nigeria Center for Disease Control, as at the end of May 2018, Adamawa, Bauchi, Borno, Kano, Plateau and Zamfara appeared conspicuous on the list of states dealing with cholera outbreak. Topping that list is Adamawa State. Going by the latest figures from the state's Ministry of Health, the number of suspected cholera cases has risen to 909, including 16 deaths recorded in 2 local government areas of Mubi North and Mubi South.
Since early May 2018, suspected cases of cholera have been reported, affecting 9 wards in Mubi North and 7 wards in Mubi South local government areas. The state government acted promptly to initiate laboratory steps towards confirming whether these were cholera or not. Cholera was confirmed within 1 week of the report of the first suspected case. All sectors of the Emergency Operating Center were activated, including coordination, surveillance, case management, water, sanitation and hygiene, logistics and risk communication.
The government is not handling this alone. The United Nations Children's Fund, UNICEF, and the WHO have been at the forefront of sensitizing the people on the need to live a healthy life. The health officials go from house to house to purify water sources and also enlighten the people on cleanliness. This door-to-door strategy has been able to unmask new cholera cases.
Case finding is very integral in the control of cholera, particularly for outbreak situation like this. We know that cholera is passed, usually the organism that causes the disease is passed in the stool or the vomit that infected patients have. And because they are in their household and continue to pass out this bacteria, they contaminate their house, and before you know it, other members of the family will contract the disease.
The team also visits the Mubi General Hospital, where cholera patients are being treated in isolated wards. The health officials believe their action has gone a long way towards reducing the fatality rate from the initial 17% to 1.7%.
Since we started this active case search, I can tell you that the number of deaths that have been recorded has dramatically reduced, because now we're able to catch those that have the disease even before they become dehydrated and then they begin to develop other complications.
The intervention appears to be yielding the needed results in Adamawa State. Health officials say if such efforts are fully replicated in other affected states, the tentacles of the highly contagious diarrhea disease can be curtailed before more lives are lost to cholera.
To talk more about it, we're being joined on the news at 10 by Dr. Ifeanyi Okudo, who is part of the WHO Health Emergencies Program. He joins us live from our studios in Abuja. Thank you so much for joining us.
Thank you for having me.
Now, Nigeria is recording a recent outbreak of cholera in some states, especially in the north. Now, what efforts is your agency putting in place to help the country fight this?
Thank you very much for that. At the state levels, in the states where cases are being reported, WHO is working with the state ministries of health first to coordinate partners to know which partners are where doing what, but also to do a quick analysis of the situation and understand what gaps there. For case management, making sure that the treatment is up to standard, making sure there's a functional surveillance system that first is able to pick up the outbreak if it's there early, but also to gather required information to be able to know where the hotspots are, and then so we can target a response there. We also have a new tool in the containment or control of cholera, which is oral cholera vaccine. So we've facilitated request of this vaccine from the International Coordination Group to be able to afford these vaccines to areas where outbreaks are. We're also supporting sensitization, the house-to-house sensitization in the homes in areas where these outbreaks are. So all of this put together would help to control the outbreak and limit the number of unavoidable deaths.
Now, you've talked about the vaccines. You know, sometimes, especially in the north, a lot of people shy away from that. So what is your agency doing to make the people feel safe and anxious, at least, to take these vaccines when they do arrive?
Yes, so I think for cholera vaccines, they're easy to administer. It's oral, and usually there's what we call pre-implementation activities. WHO is working with at the national level, National Primary Healthcare Development Agency and National Center for Disease Control, and at the state level with the state ministries of health. So essentially, there's a sensitization program going on in the communities, in the local systems, like in the churches and the mosques and local authorities. And then with this, the people know that this vaccine is essentially to prevent them from getting infected. And from the campaigns we have had, people have accepted it, and we've not had any issues with people non-compliance or rejection of the vaccine. Thank you.
Well, Dr. Akudo, what more can be done to avoid deaths, especially from cholera?
So, of course, the first instance is not to have, the first thing is not to get infected. So, in Adamawa, for example, part of the message that the house-to-house teams are carrying with them, not just to make sure that they have the right message around the water, but also the things that they need to do to prevent themselves from getting infected. That's the first thing. Then, of course, if the treatment centers are available closer to the communities where the outbreaks are. But of course, if we had water, good potable water in the areas, and good sanitary conditions, then that eliminates or at least reduces to the barest minimum the condition that makes it possible for people to get infected. So WHO on its own is working with colleagues, agencies, as well as government agencies to make sure that the capacity to contain outbreaks like cholera when they happen is there. And if we need extra capacities, WHO is also capable to draw from its resources from at the regional or at the headquarter levels. Currently, there's an analysis from the Global Task Force team in the country, essentially looking at hotspots for cholera, and then trying to develop a plan to have a longer-term control so that we don't have very frequent outbreaks as we do.
Dr. Akudo, thank you so much for speaking with us on the News at 10. Now let's find out what's happening in the world of business. The BDCs are saying something will make their job just a little bit easier. Anne has the details.
Thanks a lot, Melinda. And true, the Association of Bureau de Change Operators of Nigeria have asked the Central Bank of Nigeria to approve the renminbi or yuan disbursement to members to deepen the China-Nigeria swap deal. The president of APCON, Mr. Aminu Gwadabe, says the approval will enable BDCs sell personal and business traveling allowances to customers in yuan. According to him, the sale of BTAs and PTAs to China-bound businessmen will make them get used to the authentic features of the yuan and avoid being issued fake currencies for transactions. According to Mr. Gwadabe, the currency swap deal and its full implementation will continue to improve the value of the local currency, the naira, reducing the dollar pressure. The United Nations Industrial Development Organization has released its World Manufacturing Product Report for the first quarter of this year. That report indicates that Nigeria's manufacturing output rose by just 2% to 4.2%. But the country's performance was higher compared with the major other African countries like South Africa, which recorded a growth of 1.5%. and Egypt with a growth of 1.1%. China's output, which accounts for a quarter of global manufacturing production, fell marginally to 6.3% in the first quarter of this year, from 6.8% it was in the previous quarter, while the manufacturing output for the United States rose by 2.5% in the first quarter of this year. Let's take a look at the Nigerian equities market. It has ended this week, the fourth trading week, upbeat with a total turnover of 1.7 billion shares worth about 18.46 billion naira in 14,790 deals. Gains were sustained on the market as the all-share index climbed 0.6% to 38,928.02 amidst sessions of mixed trading. The financial services industry led the activity chart with 1.17 billion shares valued at $9.69 billion traded in 7,809 deals. The oil and gas index was the best performing among the major sector indices, followed by the insurance and the banking sectors, while the consumer goods and industrial goods indices closed negative. Let's go to the Treasury bills market now. It was bullish owing to relatively healthy liquidity and the absence of OMO auctions for this week. But average yield moderated 22 basis points to 12.62%. Investor sentiment was very positive across the short, mid and the long ends of the curve. In the meantime, 6.2 billion naira, 50 billion naira, 126.6 billion naira of the 91-day, the 182-day and the 364-day bills were all allotted at this week's primary auction. The bills were 1.4% oversubscribed, with yields crossing higher across all the bills. Yields are expected to be under pressure due to anticipated squeeze in liquidity position next week. Let's find out another market that was bullish. It's the bond market. But this time, the trading was bullish on the back of relative healthy liquidity also, as well as anticipation on the release of the May inflation figure. Average yields fell by 5 basis points to close at 13.3%. There was demand pressure on the short and the mid segments of the curve, while the January 2022 and the February 2028 bonds recorded the most significant contractions. Yields at the long end of the curve expanded following a sell-off of the July 2034 bond. That's business news for this week. Thank you so much for watching. Have a fantastic weekend. I'm Anne Nwawadu.